Today we will talk about a very common medication, ibuprofen. Surely we have all used it at some point for headaches, fever, or menstruation. But did you know that, like any medication, ibuprofen can have adverse effects? Let's start with gastrointestinal problems. Ibuprofen can irritate the stomach and intestines, causing heartburn, nausea, vomiting, diarrhea, and in more severe cases, ulcers and bleeding. This occurs because it inhibits a protective enzyme in the gastric mucosa, increasing the damage caused by acidity. Who is most at risk? Older people, those who consume alcohol or take other medications that can irritate the stomach. What can we do to prevent it? Take the lowest possible dose for the shortest possible time. When it is necessary to take it for a long time, stomach protectors such as omeprazole can be added. Another option to reduce damage is to take ibuprofen with food. Ibuprofen, like other NSAIDs, nonsteroidal anti-inflammatory drugs, can affect kidney function, especially in people with pre-existing kidney problems. How does it act? Ibuprofen reduces blood flow to the kidneys, which can make it difficult for them to function properly to filter toxins and waste from the body. If taken for a long time, it can cause irreversible damage. Who is most at risk? For people with pre-existing kidney problems, acute kidney injury, or kidney failure, ibuprofen may worsen their condition. With age, kidney function naturally declines, making you more sensitive to the effects of ibuprofen, making it easier for damage to occur. Patients taking other medications such as diuretics, ACE inhibitors, beta blockers, and aminoglycoside antibiotics may increase the risk of kidney problems when combined with ibuprofen. How can we prevent it? Strictly follow the dosage instructions on the medication label and do not exceed the recommended amount. Drink plenty of water to help maintain proper kidney function. Dehydration enhances the negative effects. A recommendation that is gaining strength is that of monthly rest. It involves taking anti-inflammatories for 3 weeks and then resting completely for a week. It has been shown to greatly reduce long-term effects. Another risk to be aware of is that long-term use of ibuprofen may increase the risk of heart attacks and strokes. How does it act? Ibuprofen can increase blood pressure and platelet aggregation, which can hinder blood flow and increase the risk of clots. Who is most at risk? If you have had a heart attack, stroke, or have coronary heart disease, ibuprofen may increase your risk if taken chronically. Ibuprofen can worsen high blood pressure, increasing the risk of cardiovascular complications associated with hypertension. Smokers, smoking increases the risk of cardiovascular problems, and combined with the effects of ibuprofen can increase the risk even further. What can we do? There are other analgesics and anti-inflammatories that do not have the same cardiovascular risks as ibuprofen. Your doctor can help you find the best option for you. Maintain a healthy lifestyle with a balanced diet, regular exercise, and weight control to reduce the risk of cardiovascular problems. Some patients may also experience rashes, itching, difficulty breathing, and swelling of the face or throat. How do you know if you are allergic? If you experience any of these symptoms after taking ibuprofen, stop taking it and see a doctor immediately. When there is a reaction of this type, it is necessary to perform allergy tests, since those who are allergic to ibuprofen tend to also be allergic to other anti-inflammatories and some antibiotics. Remember, ibuprofen is a safe and effective medication when used correctly. Take the lowest possible dose for the shortest possible time. Inform your doctor of any pre-existing conditions or illnesses. Avoid ibuprofen if you are pregnant or breastfeeding. Be careful when taking other medications. And, most importantly, if you have any questions or concerns about ibuprofen, do not hesitate to consult your doctor or pharmacist. If I have answered your question, Don't forget to like and subscribe so you don't miss any videos. Your help allows us to reach more people. If you have any questions or want to ask a question, you can leave a comment and we will be happy to respond. Thank you for your attention, and until next time.